Getting mental health care has never been easy in Fresno and many other parts of California. And now the barriers to mental health service are getting even higher, particularly for teens. On this Wired Wednesday, I'm joined by GV Wire reporter Edward Smith, who looked into this problem and is here to share what he has uncovered. Good morning. Thank you so much for being with us. Let's talk about it. What is the problem here? What do you see as the big issue?
So the big issue is Department of Healthcare Services did a big survey over wait times for children in terms of getting access to mental health care appointments. So the state auditor did an audit of that survey and found that those surveys were really lacking. As many as 2/3 of providers, the survey results were excluded. And so we really don't have a good picture of wait times. Now, what the survey results did show was that a lot of providers' wait times didn't meet state and federal minimums or maximums in terms of how long it takes to get care.
Well, tell us about CalAIM and how that affects the services.
So CalAIM is a big sweeping reform to all of Medi-Cal. So that includes the healthcare and mental health care. But when it comes to mental health care, there was a big change in payment reform to how mental health care providers got reimbursed for the services they provide to counties. So that's really had a lot of them retreating from different counties in terms of providing services because they no longer are getting the same amount of money that they used to. A lot of services are now, a lot of providers are now reevaluating what they can still provide with these big payment reform changes.
What about advocates saying about obtaining help since the implementation of this CalAIM? You're saying it's getting more difficult?
Yeah, it's getting a lot more difficult. A lot of larger providers are having to pick up where smaller providers can't. We're talking about some providers were seeing 7-figure changes in terms of what they were getting reimbursed with. So now, and this is coupled with the audit from the state auditor's office saying that wait times were already long, and now coupled with this with providers saying that they just don't have the resources to continue to provide coverage as much.
Are the Fresno County, is the county meeting the mandates for health care, for mental health care?
So that depends on how you look at it. DHCS, Department of Healthcare Services, said we were. But when the auditor took a better look at it, they had combined adult and children wait times together. And when you separate them out, wait times for children were below the state mandate. Now, adult times were within the mandate, but not children. So they actually weren't when you separate them out.
So what is the state auditor's office saying about this?
State auditor's office is saying that there needs to be more oversight into actual wait times. There are some barriers to doing that. We don't have the software, or they don't have the reporting capabilities to do that, but the state auditor is mostly saying that we don't have a good picture of how long people need to wait for mental health care.
What are the odds of the state changing CalAIM like this?
I did have a chance to speak with Assemblymember Corey Jackson, who is on the Mental Health Committee, and he said that they're looking into it, but it's going to take a major change from both houses of Congress as well as the governor to sign on to it. So it's going to take a lot of work if the state wants to change it.
And this coming at a time when mental health, particularly for young people, is such a big issue.
Absolutely.
Thank you so much for being here with us. Edward Smith from GV Wire. We appreciate you coming in on this Wired Wednesday. And Great Day will be right back.